Madam Chair, we are now live.
Thank you for that, Julian. I call this meeting to order. This is the Public Safety Committee of the City Council. All members of the committee are present via Zoom, with Councillor Benton and Councillor Davis running a little bit late. This is a remote or online meeting where all participants will be on a video or audio conference. We are holding this meeting remotely to allow everyone to participate safely while we are conducting business under a public health emergency. We appreciate your patience. Members of the public, city staff, and the media will have the ability to view this meeting live through YouTube and Zoom webinar. This live stream can be accessed from most smartphones, tablets, or computers. For those watching on the live stream, thank you for joining us. Written comments were received for today's meeting and were provided to members of the committee. Members of the public will be able to address the committee if they have signed up for public comment per the rules published on the agenda last week. Members of the public will be moved into the Zoom meeting once we begin public comment. They will remain muted until they are called upon to speak, at which point they will have 2 minutes to provide comments to the committee. After that, they will be again muted and return to the Zoom webinar, where they may continue to observe the meeting live. We will start with public comment. We have one individual signed up to speak. Will the Zoom moderator, Mr. Moya, please move in the one member of the public signed up to speak.
Madam Chair, we did have one member of the public sign up to speak, but they have not joined the meeting.
Okay, perhaps if they do join later on after the presentation, then we'll come back to that. In the meantime, we'll go to our first item on the agenda, which is presentations. And first up, we have Ms. Karen Myers with Consumer Protections. Ms. Myers?
Good afternoon, Councillor Senna and all other councillors. My name is Karen Myers. I'm the head of the Consumer Financial Protection Initiative for the city. If you could start, yes, thank you. Councillor Senna asked if I could do an overview around landlord-tenant and eviction issues during COVID, and that's what we'll be going through. Next slide, please. So the relationship between the housing crisis that we're experiencing and other public safety and health issues is significant. There is a strong correlation between evictions and increased poverty, adverse health consequences, and other problems. And one of the pieces of research conducted on that is a book called Evicted: Poverty and Profit in the American City by Matthew Desmond. If you have not read it, I recommend that you review that. Next slide, please. So let's start with the basics. New Mexico still does have a moratorium on evictions from the New Mexico Supreme Court. It applies only to tenants who are unable to pay their rent. It does apply to all residential tenants, including mobile home lease agreements, and there is no termination date at this point. There is also a federal CDC moratorium that has been extended to January 31st. The provisions of that moratorium are different, and I've listed the website that you can go to if you want to get the declaration that you can fill out and give to your landlord. But even if you don't qualify for the CDC moratorium, the New Mexico moratorium applies if you are unable to pay rent. Next slide. So the first thing that we are recommending to people do is apply for rental assistance. The city of Albuquerque has been very, very active in getting rental assistance out. Many tenants do not know where to go for help. We have a new project in the city, Financial Navigators. And if you call 311, you can be referred and linked to a financial navigator who can help you determine what financial resources are available, both at the city and state levels, to assist you with the kinds of problems you're facing financially. So it's not just rental assistance, but it's other kind of help. Albuquerque, you can call directly if you'll go to the next slide. And our Family and Community Services, and I think Carol is on, she probably can expand on this, but the Family and Community Services, the Health and Social Service Centers are doing an incredible job of giving out, of providing assistance to qualified families and individuals who have applied over the last several months. This is the information about where to apply. There is also state assistance through the MFA, and the website to go for that application process is there. There is also available at the city a lot of information, some of which is what I'm going to be covering today, but specifically information about what to do if you can't pay your rent and what your rights are. And that link is the one that's listed at CABQ Tenant Rights and Eviction Prevention information. What's really important, and what I think all of us who are doing the eviction prevention and rental assistance work at this time at the city, what we've come to understand is that we've been able to reach a lot of tenants, but a lot of people don't know where to go for help. And to the extent that the city council, when you're talking to families who are struggling, can send them in the right direction is really advantageous. There's a lot of communities who this is the first time they're struggling or needing this kind of safety net assistance. Other people who are specifically vulnerable and rent burdened, and they also very much need the kind of assistance that we're offering. Next slide. So what about eviction issues? There's a lot of misinformation out there. Tenants can be evicted for failure to pay rent generally, and failure to pay utilities. The process is that the landlord has to give you a 3-day notice, and you have a right to cure. That's why it's really important to apply for rental assistance as early as you identify that you're going to have a problem, because it takes some time to go through that process. And so it's helpful to get that assistance as early as possible. Next slide. Now, the moratorium does not stop tenants from being evicted. It just stops them from being evicted for only non-payment of rent. And we're going to talk about whether it's working effectively in a minute. But that still means that landlords may evict tenants if there's a violation of the lease or the law. And that protection for landlords continues even under the moratorium. Next slide. Tenants also can be evicted for other kinds of less egregious behavior, noise or disturbing other tenants. In this situation, they get a 7-day notice. They have the right to cure the problem. If they cure the problem, they should not be evicted, and they should be able to maintain their housing. Housing stability is a major issue in Albuquerque, and it has only gotten worse because of COVID. Next slide, please. So what's happening as a result of COVID is the moratorium from the Supreme Court went in place in the end of March. So that means most leases are somewhere between a 6-month lease and a 1-year lease. Many landlords are terminating the lease as the lease expires. So that means that if you're on a month-to-month lease, the landlord is using that as an opportunity to evict the tenants and to urge them to vacate. This is allowed under the law. It is a problem. It is a loophole in the moratorium, and we are seeing it happen in many families. So families are finding that even though they've applied for rental assistance, or even though they're trying to work with the landlord, we have reports from both Bernalillo County and MFA that there are some landlords who are not willing to cooperate or provide the paperwork that allows them to get the rental assistance, and are using the end of the term of the lease to evict the tenants. Next slide, please. Tenants cannot be evicted if they are the victim of domestic violence, if they have requested repairs, and then the landlord tries to retaliate. If they've called code enforcement for reasons of disability, race, religion, gender, sexual orientation, or violations that are a result of disability, unless it also involves some other substantial violation or violation of the law. Next slide. So what's most important for everyone to be telling tenants at this point is that they have to act. They have to know what their rights are. They have to be proactive. They should apply for rental assistance, and they should talk to their landlord to see whether the landlord is willing to work with them. Oftentimes tenants think that when they get a notice, a 3-day notice or a 7-day notice, that means they have to leave. That's not the law. They have a right to go to court. They have a right to contest it. They have a right to ask the court to take into consideration their circumstances. If they don't do that, they will be evicted. So being proactive is really important. Next slide. New Mexico prohibits self-help evictions. That means the landlord cannot evict someone without a court order. A tenant can voluntarily leave, but it has to be voluntary. That means that the landlord cannot change the locks, they cannot disconnect the utilities, they cannot threaten, they cannot use force. If they do that, a tenant can call the police or file in Metro Court, and the police should come and protect the tenant from being illegally evicted. Next slide, please. So evictions, next slide. Evictions during COVID have gone through some changes. Because of the moratorium, there has been a reduction in eviction filings. However, the data that we've seen is an anticipation of perhaps as many as 35 families facing eviction in the near future as a result of the loss of income, loss of jobs, furloughs, and all of the impact of COVID. That does not even necessarily include data because it's pretty much difficult to get this kind of data about the number of tenants who have been, shall we say, encouraged to vacate because their lease has expired, even though the real underlying reason is their inability to pay rent, which should be protected by the moratorium. In order to protect yourself, though, you must appear at the court hearing telephonically and tell your side of the story. If you don't go to court, you will be evicted. Unfortunately, one of the things that tenants face is that all of the rent will become due when the eviction stay is lifted, and that's why it's important to look for and find the rental assistance so that they can hopefully pay off the arrearages before they're faced with that circumstance. And hopefully, if they can do that proactively, landlords will cooperate and work out, arrangements for them to stay so that they don't become homeless or end up having to double up with or triple up with other family members, which has a negative health consequence, as we could imagine, as a result of COVID. Next slide, please. So what's most important is not to do nothing. To do nothing means you will be evicted. To do nothing means you could end up losing your possessions. You could end up on the street. So it's very important to appear at the hearing in Metropolitan Court by telephone at this point, and making sure you call in early enough so that you're there, and that you provide information to the court about what's going on. You also want to tell the court if you live in a subsidized apartment. You want to tell the court if you're unable to pay the rent. You may want to also tell the court if you have challenged the termination of your lease. You may want to show the court that it's because of non-payment of rent, not just because, not for any other reason. That would be helpful. Next slide. So there are a lot of resources in the community. I've already identified all the rental assistance that people can consider. Bernalillo County also, through part of December, had rental assistance. They may be opening up again, so I have not included them in the listing because I don't have their updated plan, but we will be clarifying that. New Mexico Legal Aid and Senior Citizens Law Office are solid referrals for people who are facing evictions, and they can provide advice and legal representation. There is a renter's guide. Many landlords ask, well, how do I find out what my obligations and my rights are? Well, there's a landlord-tenant hotline. I haven't included it here, but there is available a landlord-tenant hotline. And the renter's guide, which is available online now, provides information for both the tenant and the landlords. And so if you need assistance or need to understand what happens if, this is an excellent resource for you. Also, we're encouraging people who are finding that they're having code enforcement problems with the landlord to call code enforcement, because as things go on, there may be problems that the landlord, who may also be struggling because of COVID, is less willing to repair or fix because of the financial challenges. One of the things I think that's most important to remember is that when rental assistance is provided to tenants, the money goes to the landlord. So it really helps both sides of the relationship. The landlord gets the rent paid, the tenant gets to stay in the premises. And many, many landlords who are struggling, particularly smaller landlords, could also benefit by working with rental assistance programs to get their tenants this information and to get them, because the money goes to the landlord, and that can help forestall whatever financial problems they may also be facing. So it's a win-win for everybody in that situation. And then obviously 911 if you are being illegally locked out to seek assistance. And that's my presentation, Counselor. And if you have any questions from anyone, I'm more than willing to answer them.
Thank you for that, Ms. Myers. Counselors, do you have any questions? As a reminder, please use the raise your hand function on the Zoom webinar so I can see and come back. Any questions? No, Ms. Myers, are the resources that you shared today in other languages, and how can community members access the PowerPoint you shared today?
Well, the PowerPoint is new because I did it just for you. It's been updated. All of the information in terms of the eviction and what to do if you're unable to pay your rent is on the website in multiple languages and easily downloadable. That was the link, the Eviction Prevention link that was at the end. Then we are translating all of the updated information about rental assistance into multiple languages, and that will also be at the website around eviction prevention, as well as specifically the rental assistance information. And all of that's available, and we have a commitment for everything we put out, we are translating.
Well, thank you for that. I truly do appreciate that in this presentations. And if counselors don't have any questions, we'll move on to our next presentation. And thank you again, Ms. Myers, for making this time. All right, next up, we have a presentation from Senior Affairs, Director Sanchez.
Okay, can everybody hear me okay? Wonderful, thank you so much. Okay, well, thank you for allowing me to be here today. I'm very proud to present this information on how the Department of Senior Affairs has responded during this pandemic and our continued commitment to ensure the well-being of our seniors. Next slide, please. We've always offered robust services and programs, as many of you know. That is also offered, obviously, to those 50 years age young, to also centenarians, active folks, to those living in isolation and are homebound. And our services are geared to keep seniors safe and independent in their homes. Through our transportation services, meals programs, recreational activities, case management services, home services, and much, much more. And we also serve youth and families through our multi-generational centers as well. So our commitment to our citizens holds true even now more than ever. Next slide, please. Now, when COVID hit in March 2020, we knew that it was imperative to maintain critical supports for our community. The governor's public health order was going to have a great impact on seniors, as she was requesting for folks to stay home as much as possible, and that seniors had a higher likelihood of being hospitalized or dying from the impacts of COVID. So we closed our facilities to safeguard the public, and we pivoted much of our staff to stand up essential services and be a resource of information. Our Senior Information and Assistance line, 764-6400, if I can put that plug in there, is our gateway of all of our services. We experienced a significant increase in calls, folks that were looking for food services, supplies, as the general community's hoarding impacted those unable to fend for themselves. And we knew we were just going to have to step up our services in a safe manner, such as transporting individuals to medical appointments still, case management assessments, developing a pick up and go meal plan at closed sites, and expanding the emergency home delivered meal program. Next slide, please. Now, as we continue to be nimble and flexible, we saw tremendous growth in the request for our services. What this graph shows you here is that we've doubled the number of clients we have served in all areas of our work. This goes back to FY17. And you can see that compared to the time period, if we're just looking at 2019 in July, the percentage increase of folks accessing our services has grown by 90% during 2020. There are a lot of services included in this graph, but I'm going to point out some key contributors. The Area Agency on Aging has supported our meal expansion, both for emergency meals, home delivered, and the convenience of our pick up and go meal model site. Since the pandemic began, we've served more than 600,000 meals to date. That is a 530% increase in meal preparation. Also, the department has more homebound clients to serve. Folks are now aware of our services, and we want to partner them with our case managers to do in-home assessments that right now, through the pandemic, are not available, but we need to be able to continue serving these clients to make referrals for perhaps respite care, homemaker, home delivered meals, medication management, and so much more. Our case managers have about 31% more clients to serve. And of course, as I mentioned, it's challenged by their inability to do in-person assessments because clients do not want them to come into their home still. It's important to point out that DSA provides services for all of Bernalillo County. While other agencies have closed their doors, we have prepared and delivered meals to Bernalillo County residents, and as far as the village of Tijeras, to further protect and support our community. Our department has been part of the safety net, even assisting with food distribution efforts for individuals sheltering at hotels, and even displaced seniors after a community fire that several of you are familiar with. We have increased our partnerships to offer grocery distribution, flu shots, wellness clinic drive-thrus, tax support, and have worked very closely with the Senior Citizen Law Office and the Department of Family and Community to assist folks with utilities and rental assistance that's available. Next slide, please. And CARES funding has made a difference. We've worked to stand up other programs to provide safety and support, such as our senior assistance cards that help residents access culturally relevant food at local markets, grocery and supplies delivery by DSA, expanded our shelf-stable meals availability, emergency meal delivery, our firewood, which is our annual firewood program, expanded by nearly three times the amount that we typically get in a year, and so much more. Our staff has been thoughtful and creative and learning how our supports will continue to change because of the pandemic. Next slide, please. And lastly, the work ahead. We know that we're going to be part of this vaccination rollout. Our work will be very important, especially with assisting with registration. We're going to continue to provide accurate and supportive information through our information and assistance line, the 764-6400 number. We know that we're going to have to work with residents on some of the initial barriers of the DOH system. There's some of our seniors do not have access to technology and internet, and connecting them with the state's hotline is going to be really important. We're poised to stand up our vaccination sites at our facilities once vaccines become available. We'll be able to transport individuals when needed and also connect medical personnel to distribute vaccines to homebound clients once available. We're working to understand the long-term impacts this is going to have on our community. As we know, COVID will move more folks into poverty, and seniors with the least wealth will be the hardest hit, relying on food assistance programs. And additionally, there is a concern that social isolation has a serious detriment on people's well-being, and we know that we need to be there for our seniors. It's important that as we work to open up our centers, which we are all looking forward to that day when we can safely do so, that we're prepared for the increase of folks that need our services and our supports as we all continue to grow older and live longer in our community. Next slide, please. So we know we have a lot more work to do. In the meantime, we're going to continue working hard and rise to whatever challenge comes up. And as our most recent employee shirts, even though we're socially distanced, we are still 100% there for our seniors. Thank you so much.
Thank you for that, Director Sanchez. Again, counselors, if you do have any questions, please use the raise the hand function. Counselor Bassan?
Thank you, Madam Chair. Director Sanchez, thank you so much for all that you do. And it's an amazingly well-oiled machine from the few experiences that I've had with your department. So my question is, and can you just send me, or can we have a future discussion about what at-home assessments look like? I think that would be really beneficial to answer some of the questions that I have pertaining to seniors, but then also some other aspects of projects that I'm brainstorming. But I think, and I recognize that you said that they're minimized right now, and that's completely understandable from these seniors, but also what are you doing to still telephonically? Are you telephonically assessing seniors right now, or how does that look?
Yes, it is. Typically it happens in person with our case managers going to the homes of these seniors. We are doing those over the phone at this time. And then of course, we always do a follow-up phone call, many wellness checks in between with other things that come up as certainly this pandemic continues on.
Okay, great. Thank you so much.
We'd be happy to send you that because I think it'd be helpful for all of the counselors.
Perfect. Thank you very much, Director. Thank you, Madam Chair.
Yeah, I just want to recognize that Councillor Davis and Councillor Benton did join us earlier, just for attendance, but Councillor Jones.
Thank you, Madam Chair. Director Sanchez, I just have to say how really wonderful it is to see what we're doing for our seniors and in the senior centers. I was lucky enough to get to watch Santa Claus at Bear Canyon Senior Center and talk to, I was blessed I got to talk to every single senior who drove through with my mask and distanced, but they were so pleased at this idea of having the drive-through coffees and the Santa Claus and candy canes, and it's such little things that make life better and get them out. There's such a socializing group. I mean, they're just social little people. They just love being around and doing, and now they don't have the ability to do for others, which I think is the most difficult for them to handle. So anything that we can do, that you see the council could do to help increase that awareness of how much they need human interaction, let us know. It's an awful time for them. They are in dire need of people contact, even on the phone and videos or drive-by. So thank you, Councilor or Director Sanchez, and for all your team and all the senior centers. Thank you.
Thank you. I will certainly pass that along, and we appreciate any of the counselors coming to any of our sites and seeing the work in progress. Thank you so much for all your support.
Councillor Benson?
Thank you, Madam Chair. Director Sanchez, sorry I missed your presentation, but I'm sure it was fabulous. As was said, you're a well-oiled machine. And speaking of well-oiled machines, I worked with one on the day before Thanksgiving down at Barella Senior Center, and it was quite the operation, giving out dinners, and it was a menu of several different dinner options. So it was pretty complex, but it was pretty nice for the seniors who were picking up those Thanksgiving meals. And I could see what a great bond your staff had with those seniors. So it was really a lot of fun. And actually, it wasn't fun. It was really hard. I was basically the gopher that was taking once they got the order together, I was taking the bag and trying to figure out which car it was supposed to go to. And but they really moved that food through, so it was a well-oiled machine. So, so I agree with the characterization by Councilor Bassan, and just as I got on, that it's a well-oiled machine and a good department. So congratulations.
Yes, and I got to definitely see the inner workings at Los Volcanos Senior Center at every meal distribution that I've attended. So I do appreciate all the staff, especially at Los Volcanos, and those that came from other sites as well to help with the distribution. One of the questions that I had, and a lot of constituents are actually reaching out on, is actually the vaccination rollout. I know you did touch on it briefly, but one of the biggest issues, as you stated, is that lack of having computers or internet access. So they've been calling the hotline and they want to know how to sign up, but they're having some difficulties with that. If you can touch more a bit on that and how Senior Affairs can assist our community in registering.
No, I appreciate that, Counselor. And if many of you probably saw this morning's journal article regarding some of the frustration on seniors, even if just trying to be able to use the website. We know that there are some challenges with the DOH website. It went up very quickly. We continue to work with other partners, such as the Area Agency on Aging, the State Department, to get some of those items modified for our seniors that do have technology and are attempting to go ahead and register. What we can offer supports on the local level certainly is through our Senior Information and Assistance line at 764-6400, because that is where we're going to get the most accurate information given to these folks that may be frustrated. We do know that the state stood up their hotline to be able to provide support. We don't have direct access, obviously, to the DOH websites to make modifications to their website, but we're going to certainly try to help as much as possible, provided obviously that they have an email address. But we can be able to help them and assist them over the phone on the local level. But it is a challenge right now as this continues to roll out, and we just want to encourage individuals to contact our information assistance line so that they have accurate information about the vaccine and how this registration process is happening, so we can be able to assure the public on a day-to-day basis as things continue to evolve.
Thank you for that, Director Sanchez. And one last question. I know that even some that have called, I'm not sure if you do have this question or if you can follow up or the answers to this question, but one senior individual registered himself and his wife, but used only one cell phone number because they didn't have a landline. Now they're confused who is who and who gets called in when. So they're kind of wondering, is it just one cell phone number? Is it one landline? Is it one email? Do people have to sign up individually and not as one, as a couple? Unfortunately, they registered as a couple and now only one person has a code and they don't know who that code goes to. So if you can follow up, if you don't have the answer to me right now, if you can follow up offline, that would be really helpful.
We would be happy to look into that a little bit further. And those are some of the challenges that we know folks are going to have by, if there is two in the family, it's registering and using one phone number. So we do need to be able to work through some of those kinks, and we will continue to communicate that up to the state level as we assist some of these folks. So I'd be happy to look into that for you.
Thank you for that, Director. Appreciate you and your staff so very much, along with all of our other counselors on this committee. So thank you, and we'll go on to the next presentation with Family and Community with Director Carol Pierce.
Great, thank you. Thank you, Madam Chair Sena and City Councilors. And let me just get and thank you for showing the presentation. So I really appreciate the invitation to come present what our department is doing to provide care during this pandemic. So next slide, please. Hold on one second. Okay, great. So I think I've got one slide before this. Sorry, just trying to get oriented with Zoom. Great, thank you. So I did want to include overall here at Family and Community Services, we really feel like our responsibility during this pandemic is to continue to provide those essential services and in a true public health fashion, be that safety net for our most vulnerable people in our community. And so those services include, and I've listed them there and I'm going to go into more detail, eviction prevention, as you heard about rental assistance from Karen earlier, and I'll dive into some of those details, food boxes, supportive housing vouchers, support for folks in our community or who are unhoused and distance learning. Next slide, please. So what's our eviction prevention program, and as Ms. Myers showed, and we work very closely together, we have a weekly Monday call on eviction prevention, trying to coordinate all of our work together and to be aware of new resources coming into the community. But our 4 health and social service centers, which she had highlighted on her screen, here since this pandemic, we've distributed about $900,000 to really help with rental assistance for those having trouble because of loss of job and many other reasons. And that's been a total of 968 households. What's happening right now is we have a new $1 million of community development block grant HUD funds coming into play, and now those are being distributed. And I should say that of that $910, that was CARES Act, as well as we have some One Albuquerque Fund money. And of the money that we were allocated, we've got about $50,000 left. So I'm really proud of our team for working to get that money out the door. And as individuals are interested, they can call 311 or call directly to a health and social service center. Right now, I should say, as you're probably tracking what's happening nationally, there is the potential of a large amount of eviction prevention dollars coming into our state, roughly 200 million, with the option with a community the size of Albuquerque, about 90 million. Now that's a lot of money, but we have done the due diligence part with the mayor sending a letter to the Treasury Department, that's who it's coming through, not HUD in this instance, to begin that process to access some of those resources for eviction prevention. And I did want to just add that I know several counselors I've talked with, and we've had conversations with landlords, with business owners. And I do want to say that we're engaging in, I might say it's an experiment with one of the prominent landlords in town, working with somebody, boots on the ground, a nonprofit agency, to really try to connect people with the resources for eviction prevention. This was a landlord who talked to me about having 120 people in arrears, and I can't tell you what percent that was of his overall holding, but 120 people in arrears, and he was out about $300,000. So we are working with him to see what can we do to really make sure people are getting connected to the resources. And that includes those other resources that Ms. Myers mentioned as well, whether it's the Mortgage Finance Authority, the city, or the county. So I really appreciate that we're diving in deep to make sure what can we do to work with landlords so we can keep people placed in their homes. Next slide, please. Food boxes, so important, the work that we're doing through our health and social service centers. And you can see the 13,000 roughly food boxes distributed since March. Two things I want to highlight that have been really quite notable to me. If you've been tracking this, again, everybody knows we have health and social service centers, one in each quadrant of our community. And historically, our East Central Health and Social Service Center up there in San Pablo has been the one that's roughly given about 500 boxes out a month. Alamosa on the west side is meeting that. And that has happened since this pandemic has occurred. So they are distributing about 500 boxes a month. I will say that we have rallied fellow city employees, especially Albuquerque Fire Department, to really help get those boxes out to people's cars, because it's a whole new process in a pandemic to distribute food. I also want to say I'm very excited. We have a capital improvement project going on at Alamosa, which changes our room out there for food storage. We have, because of the 500 boxes a month, we've needed that before when it was even less distribution, to have a better distribution system out at Alamos. And I'm very excited about that project underway. Next slide, please. One of our favorite topics and so important during a pandemic is permanent supportive housing vouchers. So in this current budget, we have about 6 million in permanent supportive housing. And right now we have actually got about 499 people housed the first quarter. And our goal is to get 630. So it's important to know these are recurring funds. These are with people that we're working with. And so these contracts are in motion, and we're very excited about getting people housed. Next slide, please. So for rapid rehousing, and that's usually 1 to 2 years of housing, we have 3.7 million in that fund, and 2 million of that is this non-reoccurring money that we've got that we are grateful to have. So as you can see, our goal is to get 382 people housed, and we're about at 162. What I really want to highlight, and right now, and I'll talk about our system for housing unhoused, which includes 3 wellness hotels. We are doing a fast track to housing in one of our wellness hotels. That's what we're using, that $2 million. The contracts are underway. And as of right now, we've got 50 people in that wellness hotel engaged with case managers and beginning that entry point into the housing. And we're very excited about what that opportunity gives us to have housing navigators, to have case managers, and we're doing that with CLN Kids, we're doing that with Albuquerque Healthcare for the Homeless, and the Pathways Navigators with UNM. Next slide, please. I just want to highlight, this is a story from one of the people that is with the Fast Track to Housing, and it's just a very common story of a woman. The name has changed, and she was here. She came here to work with and be with her family. That didn't work out. She became homeless. This is a person that had been employed, had a good living. Because of medical conditions and how it was impacting her, she was on the streets. I am so proud to say that now she's been housed through the rapid rehousing, and she's able to get the medical care and other access that she needs. What's really important in many of our rapid rehousing contracts is we've got some resources to get furniture and the household items that people need. Sometimes we might forget about those items, but there are so many other support items that we need besides the voucher to get people successfully housed. So this is one of many successful stories that I thought I would share. Next slide, please. So it's always worth mentioning that in this pandemic, we expanded from the Westside Emergency Housing Center to 5 different hotels in our community. As of yesterday, we were housing about 724 individuals, the most that the city can really account for that we've ever housed at one time. What is notable and heartbreaking is that 184 of those individuals are children under the age of 18. On any given day in the past at the Westside Emergency Housing Center, when it gets really cold, we might have 450 people out there. And that's in non-COVID times, so people are in upper and lower bunks and not 6 feet apart. Right now, and at any given time on the west side, we might have at the most 25 children. Again, I tell you, 184 children under the age of 18. When I mentioned the fast track for housing and the people that are enrolled in that program, over half of them have children, and we're seeing the benefit of getting them into rapid rehousing. So the way this whole expanded service to help unhoused individuals. There's a call daily at 11 a.m. that the city leads. It is with the county, it is with the state, it is with UNM, and it is with many of our partners. We lovingly call ourselves the Corona Crushers, not because we've achieved that yet, but we really have done such amazing problem solving on a daily basis to keep the safety net strong and to address the needs of many people. And I will also add that we're very excited that people without homes are in the 1B category to receive vaccines. We're working very closely with the Department of Health. What our aim is, this is not happening yet, but is to do a clinic out at our west side to get folks vaccinated. I'm also very happy to say that many of our frontline workers that are in these hotels and our nonprofit agencies have been vaccinated for COVID. And we're very excited about that. Next slide, please. So it's really important when we look at what FCS is doing to keep that safety net alive and what we're doing for public health during this pandemic is all that we have done for distance learning. So just as Director Sanchez talked about with great pride that city workers continue to serve through this pandemic, I share that same pride. So at our 22 community centers, we have continued to offer that distance learning, and our staff have risen to the occasion to figure out what it means to get kids logged on in our community centers and following their schedule with APS and supporting them through this. Similarly, we also are child development centers, which have been really important to make sure people that are able to work can, so their children are being taken care of. Our 25 child development centers have remained open during this pandemic. I'd also like to say that we work closely with the state through licensing, through all these facilities. And right now our child development workers are tested every 2 weeks for COVID. And I'm very excited to hopefully get them prioritized also to receive the vaccine. And I think with that, that's my last slide. And I would love to answer any questions.
Thank you, Director Pierce. Councilors, any questions? Councilor Bassan?
Thank you, Madam Chair. Director, thank you so much. A couple questions. When you said 499 people in permanent housing, is that people or families? People, right?
Yes. You're asking about our, yes, that's people, not households. Yes.
Okay. Okay. And then when do you anticipate?
Excuse me, I'm sorry, Councilor Sana and Councilor Bassan, I did not answer that correctly. It's 499 households and our goal is 630 households.
So it's even more people per se than with that. So awesome. That's great. That's great to hear. And then when you said there's about $50,000 left to spend and that's remaining, when is the anticipated timeline to spend that, or does it revert back, or what's the plan?
Councilor Sena and Councilor Bassan, no, it doesn't revert back. The reason I highlighted that, out of that 900,000, we were very proud that we got all that out the door except for 50,000, and that was CARES Act. And with the new extension, if you will, of CARES Act dollars, I'm very proud the city was very successful allocating and getting the money out the door, but now we have that 50,000 to also continue to get out the door. And it was, that's really important money without restrictions. So that's in the queue with the new $1 million coming in of CDBG and the anticipated new money from the federal government.
Awesome. Thank you, Director. Madam Chair, just one more on that. And really it's just a follow-up that I do have more questions, but I am looking forward to speaking with you later this week. Yes. So thank you. And I'm not going to take everybody's time, but I look forward to learning more and picking your brain. So thank you so much for all you're doing. And you all should be very proud for getting that money out.
Thank you.
Councilors, any other questions? Director Pierce, so I did have a few questions in terms of the vaccination rollout? I know it's just anticipated, but what other services, I guess, are people going to be transferred, getting processed then that way to get vaccinated? You know, or are they going to have to sign up ahead of time? How's that going to work?
Counselor Sena, you cut out right in the middle, but I think what you're asking is our process for vaccination with our unhoused population. We are currently working on that, and this is part of what Counselor Bassan's questions are as well. And we will be meeting, I believe, Thursday together with CAO NAIR. And we're in that process. I think I'll have some more information by the time we meet Thursday, because we're just in the early stages of that. So I don't have that information right now.
Okay, well, I would love to follow up with you on that once you get more information. I know that we're actually getting some constituent calls on that as well. And, you know, of hearing how many are at the West Side Emergency Housing Shelter, it's absolutely heartbreaking. I know that I was given a recent report just of the West Mesa High School. There were 154 unhoused kids there. So, you know, I'm curious what other resources we can be providing them. I mean, one of the biggest issues that they're facing is actually internet access. I saw a report that even there were over 1,000 Fs in the month of October alone from that high school, because there has been a lot of issues between access of internet, slow internet. So are there more resources? Are they going to school at the West Side Emergency Housing Shelter?
Counselor Sena, thank you for those questions. Well, right now, as of this moment, we don't have families out at the West Side. And part of it we had to rearrange because of the number of people. So that's why we've got the number of families we do currently in the wellness hotels. And all the wellness hotels, as well as all of our community centers, are part of the Wi-Fi system that is spread around the community to make sure students have access to that. With that, I will say we have worked closely with Title I, the McKinney-Vento Act, who get resources at APS to help homeless families. And we're continuing to work out those systems. They've been part of our fast track for housing, and part of that discussion. But so Wi-Fi is available. We're trying to support those families that need it.
Thank you. And one last question. I know that you stated over 12,000 food boxes have been distributed. We've had this discussion before as well about the culturally appropriate food boxes, especially for those that were in like the wellness hotels, for those that had to quarantine and couldn't be with their families. So can you touch more about that?
Counselor Sena, thank you for that question. Right now, at the West Side, as well as the 5 hotels, people are receiving 3 meals a day. If there are dietary restrictions or anything, that's honored. Our food boxes, and when we discussed this before, and I followed up, especially with our East Central team, as they're working with families that may have particular food preferences, those are gathered and honored, but they're not typically there in a food box, but they work with the individual families. But I do think this is an area we continue to be aware of and can make improvements.
All right, thank you, Director Pierce. That's all the questions I have. I do hope to follow up with you and possibly even Counselor Bassan on my questions earlier. So I do appreciate it. And if counselors don't have any other questions, we'll move on to the next agenda item. All right, we have item B. Counselor Bassan.
Thank you, Madam Chair. I would like to move R123, setting policy for interim appointments of Albuquerque police chiefs. I would like to move this without recommendation. And I say that because we've been in conversation with the administration and with city legal. And as this is appearing right now, as R123 is appearing right now, it's going to have some edits and changes, but I think that most importantly, it's going to need more collaboration with the administration, but then this is such a huge ordeal that I think that it's going to be beneficial to go ahead and have the full council's input on it so that they can go ahead and weigh in with their opinions as well. And we can go ahead and work through these changes together for the best opportunity for the city and for council without overstepping any kind of reach and keeping things within legal parameters.
Thank you, Councillor Bassan. Councillor Jones, is that a second?
Yes, it is. Thank you, Madam Chair.
All right, thank you. Councillors, any questions and comments from the administration? Going once, going twice. All right. Ms. Montoya, can you do the roll call for the vote?
Absolutely. Councillor Bassan,
Yes.
Councillor Benton,
Yes.
Councillor Davis,
Yes.
Councillor Jones,
Yes.
and Councillor Senna.
Yes.
And that passes on a 5-0 vote.
All right. Well, thank you all. There being no further business, the Public Safety Committee meeting is adjourned. It was a pleasure chairing